Hello, I'm Dr. Patrick Gallagher. I practice at Gallagher and Kuhn Dental Group in Westminster, Maryland. And a fun fact about me is that I've traveled a bit in my life. I've lived out of country, so I'm pretty adventurous when it comes to eating. And I will eat just about anything, but I will not eat breakfast food for dinner. No pancakes and sausage for me for dinner. I will not do it. With the varied background, it helped me come to dentistry as a I wasn't straight out of college. I had experience. I lived overseas. I learned how to work with people and how to communicate with people that I could not communicate with and and be a part of an organization that I was very uncomfortable in and found my way to have success and relate to people and work with people and those skills I think have helped me with working with patients who are uncomfortable, who don't like to be in the dental chair, are very anxious. I think those experiences and the level of maturity that I brought to the practice of dentistry as an older student, as an older dentist, helped me relate better to my patients and help me with my team as well. Community is very important to us. Relationships are very important to us. Relationships with our patients and relationships with the community. One of the things we do is that for patients who we want to thank them for the review that they've given us or a referral or something like that, we will go to businesses, local businesses and restaurants and bars and purchase gift cards and give those gift cards to patients so that they then go back to the local businesses. We might give a gift card to a patient who maybe we didn't see as on time as we would have liked. But when that's the case, it's usually because we're helping someone else in the practice and it just took a little bit more time. So community is very important. The Celtic Cantor is an example of our involvement in the community and the things that it does benefiting the community and charitable organizations is how we try to relate in our community. I was working in the financial services industry, and the bank I was working with was having trouble, and it eventually failed. In doing so, there were many of us who lost our jobs, and I was taking my family to finish with the health care that was available, took my daughters to the dentist, and as I watched what this dentist did, which was nothing special, that was the problem. It was nothing special. It was nothing special with my daughters, for my daughters. And I said to myself at that moment, I think I can do this, and I think I can do this better than this guy. And so, with the support of my family, my wife, and my children, I applied to dental school and became one of the oldest students in my class. And with my wife and my daughters, I was able to pursue my passion with vision and support. I think helping patients that feel anxious is something that I enjoy. It's something that I cherish. I think the maturity level that I have, having a wife, having children, having come to dentistry later in life, I think has helped with having an appreciation or a perspective that is more patient, is more empathetic, and reaches out to find how I can help people feel more comfortable. I have many occasions where I'm giving an injection and the patient doesn't even realize that I've given them the injection. And those are patients that don't like needles. We have, with the technology that we have in the practice, we have a laser which desensitizes the tooth. And in many cases, we don't even need to use an anesthetic. So not only do our skills help us make patients feel more comfortable, but the technology that we're using does as well. As we're treating our patients, we try to pull the curtain back. We don't look at the patient, and a patient just isn't teeth. There's more to the patient. And so we try to pull the curtain back and see what's behind there and look at the entire stage. Sometimes the The Preakness is a very important horse race here in Maryland, and sometimes I feel like a horse running down the Preakness, running down the track, but I don't have blinders on. I don't have the blinders. If I did, I'd only see what was in front of me. So I try to see the whole track. I like just try to see everything else that's around and what is important to the patient. And is it function? Is it cosmetics? Is it how they feel? Is it how they sound? Is it how they speak? I say to patients often, it doesn't matter what I do, is how does it feel in your mouth? Does it feel like it belongs? And that's how we try to treat our patients and provide the care that is best for them. So, working with my daughter was not a planned process. It happened organically. And I think that's one of the things that makes it work so well. I have skills, I have talents, and she does as well. And I think we complement each other very nicely with those different skills and talents and characteristics. So I think we can provide our patients with those differences that complement and provide good outcomes for our patients. We are one of the most technologically forward practices in the region. We have evolved dramatically with technology such as a 3D x-rays, lasers, the ability to make crowns in the office, moving away from paper. We're trying to create an experience for patients that is convenient and efficient. And so we have evolved with the community as Westminster has grown, as Carroll County has grown in technology. We are we move along with that, and we're not ahead of the curve, but we certainly ride the wave of the curve of technology.